It is that time again. Yes, it's time for our In Focus Health segment. Joining us in the studio is health correspondent Linord Moudou with some news about a hospital flotilla. Hey, hi Linord.
Hello, Vincent. Well, it's Mercy Ships. It is a global charity that operates hospital vessels in developing nations. The floating hospital ship has traveled the world, delivering healthcare to underprivileged communities since 1978. In 2007, the organization deployed the Africa Ship, a large medical facility which includes 6 operating rooms, an intensive care unit, and bed space for 78 patients with a crew of up to 400. The Africa Ship has serviced countries such as Benin, and the ship is presently on a mission in Sierra Leone. And joining us now via Skype from Texas in the United States is Donald Stephens. He is the founder of Mercy Ships. Mr. Stephens, welcome to the program.
Thank you very much. It's my honor to be with you today.
Really good to have you. Besides the Africa ships, what other ships do you deploy around the world?
Well, right now, the Africa Mercy is the only hospital ship that we have in service. We sold the other 3, the Anastasis, the Caribbean Mercy, and the Island Mercy. We sold them for 2 reasons, primarily their age and the cost of keeping them running, their size as well. And secondly, because the Africa Mercy is purpose designed, and that's to be the basis of our future ships. We do hope to have another ship to deploy in the next couple of years for Asia, and we could certainly use another one as we've not yet been on the west coast of Africa.
Now, since 2007, the Africa Ships has been traveling in various countries in Africa. Can you tell us some of the health conditions that you are able to address on this ship and treat?
Yes, we have been in Liberia, Benin, Togo, and now, as you mentioned, we're in Sierra Leone. Let me give you just a couple of examples. In Sierra Leone, 1 in 5 children will not live to age 5. This is not true in other nations in Africa, and I think the time for viewing Africa as a whole is past, because several individual African nations have made dramatic improvements, not only economically, but also in maternal and infant health, as well as education. Ghana is perhaps one of the best examples for all of us, but there are other examples in Africa as well. In Sierra Leone, 1 in 8 women will not survive childbirth. That's a shocking statistic. And one of the reasons that we have accepted the invitation from President Karoma is because he has dedicated a significant percentage of his annual budget in Sierra Leone to addressing maternal and infant mortality. We're delighted to be there and partner with him.
And before we continue, let me just warn some of our viewers that the images may be a bit difficult for some viewers, so the viewer's discretion is advised, indeed. And Mr. Stephens, now that you are there in Sierra Leone, what are you able to do? How long have you been working there in Sierra Leone this time? Because I understand this is the 5th time you are in the country?
That's correct. We came early in the 1980s. Of course, there was a 10-year-long, almost 10, not quite 10-year-long civil war, so we could not return for almost a decade, but we are delighted to be back amongst our friends in Sierra Leone. In particular, we are focusing on maxillofacial, cleft lip and palate, these massive tumors that you've already alerted the viewers that there are some shocking photos. So maxillofacial is one of the surgical specialties that we will do. Not only do we do the surgeries, but there will be capacity training in the healthcare field in all of the areas that I'm going to mention. Secondly, we will do ophthalmic surgeries for the blind. There are 65 million blind in the world today. Half of those, so 35 million approximately, are blind due to cataracts. And in Africa, as well as in other parts of the developing world, we also see children who come to us born with congenital cataracts. So literally the blind will see after visiting our eye surgeons on board the ship. Third, and there are two more specialties. Third specialty will be the vesicovaginal fistula, the obstetric fistula. I think we're all aware of the situation in sub-Saharan Africa with somewhere between 2 and 3 million women, two primary causes, 2 and 3 million women suffering incontinence. We call them the wet women. Two causes. Number one is child brides. These little girls are given away before the pelvic region is fully developed, and
Indeed.
often.
Yes, indeed.
You're aware of that.
Yes,
and
absolutely. And really quickly, how long does the mission last in this specific case, and what do you do afterwards when the ship is gone? Do you have some type of follow-up program that is established?
That's correct. Our business plan is to keep the ship in port for 10 months. And we just arrived about 2 weeks ago in Freetown, so we will stay through November. What happens after the ship leaves is a very good question, and we answer that with the capacity building that we offer on board the ship. We will train the local surgeons. For instance, in Liberia, Benin, and Togo, we were able to train every biomedical engineer in country, and also every anesthesia provider.
Mr. Stevens, unfortunately, that's all the time we have for today. Thank you so much for joining us, and good luck in all you're doing. Thank you.
You're most welcome.
And that was Mercy Ships. Back to you guys.